Before we start, a small audio note. This conversation was recorded remotely over Zoom, so the sound quality isn't perfect in parts of this episode. I still really wanted to share this episode because I believe the topic is very important and meaningful. I hope you're able to get what you need from it despite these imperfections. And if this is something you'd like to hear more about, let me know. I'd love to invite our guest back in the future for a follow-up with improved audio. Today's episode is one of those conversations that sits right at the intersection of physical recovery and mental load. And yet it's something that's often brushed aside as just part of having a baby. We're talking about the pelvic floor, and more specifically, what's actually normal after birth and what isn't. Today, I'm joined by Sofía, a pelvic floor physiotherapist based in The Hague and also an immigrant herself. Together, we're going to walk through the questions so many women are already asking, and often quietly, and we want to help you understand when support might make a real difference. Sofía, welcome to Damn Parenting.
Thank you for inviting me. Glad to be here.
So first off, I think it'll be great to find out a bit about you, where you're from, what the education was, how long you're practicing.
Yeah, so I'm originally from Spain. I've lived a bit all over the world. I've been in the Netherlands for 16 years now. I used to have a different career. Eventually, I moved into physiotherapy. I became a pelvic physio about 13 years ago after doing a very specific education that is necessary here in the Netherlands because, well, they consider that just being a physio is not enough generally. So they ask you for painful research masters. And after finishing that, you become part of a bit of a club of pelvic physios in Holland. And that's what I've been doing for the last years.
And tell us, how many pelvic physios are there here in the Netherlands in total?
So it's around 400, give and take. So it's a very small number, considering that we're in a country of around 16 million people. So that's probably the reason why a lot of people trying to find an appointment find it a little bit hard. And our waiting lists are a reality, unfortunately. But yeah, that's the reason, basically. It's just we're really not too many. But at the same time, we have great pelvic physios, and I'm just not talking about myself here, but in general, I think the education level in the Netherlands to become a pelvic physio is very high, and it's a very medical profession. Let's say it's like very professionalized, let's say, in comparison to other countries. I did some of my specialty in Spain first, and then once I moved here and I had to do all these other things, I realized, how much of a difference it makes as well. But yeah, so we're part of kind of the medical establishment in a way.
Sofía, to start, can you let us know what are the most common things women actually experience after birth that they're kind of told is normal, but actually you would recommend that they don't ignore?
Well, it's a good question. It's actually not that easy to answer, mostly because a lot of the things I'm going to say can be normal, but can also not be normal. So those things can be the classic incontinence, which is what I think most women know about. It can also be pelvic pain. That's something quite common, actually. It can be things like fecal incontinence. So basically, you cannot hold poop or gas. The gas happens very often. I would say the rule of thumb is generally, if it stays beyond 6 weeks, you should check it. The first 6 weeks, a lot can happen, a lot. You might feel very broken in a way, but you will be a completely different person 6 weeks from that moment. So don't despair. Things will change for sure. And if things stay beyond 6 weeks, then it's a good idea to check. And even beyond 6 weeks, it can be fine. It can be that incontinence will go away 3 to 6 months afterwards. It can just be due to hormones plus the birth, because the birth, we don't talk much about this, but birth, even if it's a dream birth, is an injury, always, in any case. So take it as, you're kind of recovering from an acute injury. So it's normal to have pain. It's normal to have dysfunction. Same way you're not going to start walking after you broke your leg yesterday. Well, same thing happens after the delivery. These things stay beyond 6 weeks is a good idea to check them, but it all depends on how the checkup goes. So we have a bit of a standard checkup around 6 weeks postpartum. You can always do it later. It doesn't have to be at 6 weeks, but also not before 6 weeks. For this reason, right? It makes sense to check some things knowing that they will change by themselves. Really, the only thing I would be a bit more concerned perhaps is if on week there's extreme pain. That's absolutely something you have to check, but you need to check that with a doctor. It doesn't have to be around the pelvic floor. It can also be in the abdomen, of course, but more about the pelvic floor. Sometimes there are certain things that can happen, from an hematoma to, there are different things, but you will know it. You will know, your body will tell you that this is abnormal. It needs to be checked. And well, if there is some fecal incontinence, I'm not saying that it's abnormal, but it's something that you probably need to take charge of as early as possible. But again, it's not like, it can absolutely change afterwards.
I think a lot of this is about timing. And I think many, as you say, women can sometimes sit and wait, and maybe we assume it's actually going to improve on its own. But how long should recovery actually take? Because it's quite vague there. So I'm just wondering, is it actually ever too late to start the pelvic floor physiotherapy?
It's never too late. Actually, pelvic floor physiotherapy is very useful for improving your function when things are not going all right, but it's not going to be very effective to solve problems once you're in the acute phase. So let's say that same as, when you have an injury, the physio can be there to tell you, okay, you'd rather move this way, right? You have to, if you want to go to the toilet, you have to walk in this way, use a certain crutch, the crutch, it doesn't matter. But the physio is not going to be able to cure your leg, let's say, until the structure heals. So that's what happens with very early pelvic physio. We are there to support you, to tell you, what's the best strategy for standing up or for holding the baby, for lifting the baby without hurting yourself further and without interfering in the healing process. And after some time has happened, then we can start actually exercising and treating the issue if it continues, or just doing like a normal rehabilitation process. And for this is way more useful to meet after 6 weeks. So that's why time is kind of critical only in that sense, but it's never too late, never. It's a good idea to check with the pelvic physio early, but mostly to, again, not interfere in the healing process. Sometimes we do certain things that we don't realize in the first days, like we put a lot of pressure on our pelvic floors and we try to move. Those things is better not to do them, but most of us are not aware that we're doing them. So in that sense, it's good sometimes to check with the pelvic physio during pregnancy, because on the first few weeks postpartum, is sometimes difficult to find an appointment first, but second, it's little things that you could have learned and then you integrate in your system, and then you can use them for the first few weeks, and then we can meet after 6 weeks and see where we are. But whatever stays beyond 6 weeks, it's never too late to treat, never. So if you haven't done anything, you have incontinence that continues after, let's say, 2 years, and you decide to do something about it, go for it. It's not too late. Not at all. And it's even better in the sense that at least we don't have to deal with a lot of weakness coming from, hormonal influences, or just the weakness coming from the childbirth itself, which is going to stay for some time. So I'm not saying it's good to wait, but what I mean is, like, if you need to because you're overwhelmed, and then you say, okay, when all this is over, I'll do it. It's fine. Just find the help.
You mentioned there about going potentially when you're pregnant. Is that standard, or is that just a suggestion?
Well, I think there's so much information at the moment right now online that perhaps many of the things that I could tell you in practice, you would find on Instagram. The thing is, the good idea of seeing a professional is that you can get a bit of a more personalized advice. And why is this important? Because not every woman is the same. So let's say the techniques that we use to deal with pressure on our bellies is pretty much the same. But some women have very tense pelvic floors. Other women have maybe, their coordination is really not optimal. So all these things, unless somebody sees you, you might not know them. And that can change what you do afterwards. So depending on what I see, then I can tell you, okay, this strategy would suit you better for this reason, or some women might need exercises. Most women won't, at least on their first pregnancy. But still, it's just more to get more personalized advice. And also, the amount of information out there is just overwhelming right now. A lot of women just call because I don't know what to do. Okay, there are a million exercises. Which one should I do? Then I read that I shouldn't do them. Then so they're very confused, and I completely understand. So that's when it can be useful to have a pregnancy appointment. It's not standard, not in Holland at least. I might have a couple of those a week. Women that are just curious and they want to know what's their situation and what they can do for preventing, possible issues. So it happens, but it's really not standard.
Well, I can definitely attest to what you just said there about being overwhelmed with information, because I did the traditional Kegel hold. And by the time I did get to my Beckenbodem, they said, you actually need to do the complete opposite of that. I needed to actually relax the entire area. So that was definitely a big experience for me. So for anyone listening who might be thinking, okay, maybe I should look into this, there probably is also a bit of hesitation or uncertainty. First off, do we need to go to the house arts to get a referral?
No, absolutely not. You're free to come to the practice directly. You might need a referral if you only have the basic insurance and you would like your basic insurance to cover the appointment, but they would only cover it if your main complaint is urine loss. So if that's not an issue, then yeah, you will be covered only if you have what they call here full versekering, which is the extra. So if you're covered for physio, basically. So normally, if you're covered for physio, you can choose to come to practice anytime.
Well, that's quite a relief. Can you actually tell us what actually happens in the pelvic floor physio session?
Well, normally we start with an intake, which is a bit of a standard here in Holland. We have about an hour. And what we do is, well, we'll first talk a lot. I have to ask you a lot of questions, quite personal, some of them. So it's all going to be about pee and poop and sex and all these things. Not just during the pregnancy, if we are referring to pelvic physio postpartum, but also before pregnancy, because, who you were before your pregnancy can also determine a lot the outcomes after birth sometimes. And then after that, what we do is a checkup. And that checkup, if it's postpartum, it will almost always involve an internal exam. That's why you're there, right? So we really need to see how the pelvic floor muscles are doing. So in that case, we ask you to try and contract, then try and relax. Then we have to see what happens when you cough, when you push, when you do certain things. Then we see how your coordination is going, your strength levels. We also have to test that with certain exercises. And then after that, we also do a bit of an external exam in which we're mostly paying attention to how your core is working in general. So how's your stability at a functional level? So we would ask you to do very, very simple exercises to see how your core behaves. And then we will also check the abdomen to see if there's any diastasis, which is quite a concern for a lot of women, less of a concern for us, I have to say. But yeah, we always check. And then depending on the results, then we would start a series of exercises. We will also show you how you can do certain movements. We will address all of your doubts, which are many, many, many after the delivery, because suddenly, you're left with this body that you don't recognize a lot. And everything is different in a way. Everything's going to change as well, but at first it can be quite daunting. And yeah, and then we see each other sometime later because the exercises are something that you would do by yourself. So we're there to guide you and supervise you. And I know in other countries like France, sometimes as well in Spain, where I come from, it's standard to do a sort of a rehabilitation. So you go sometimes more than once a week to a midwife or a physio to do exercises. We don't do this in Holland. At first, I disagree, but I came to believe it's actually the best approach, the way they do it here, in my mind at least. I wish there was more prevention here, but then at the same time, there's no over-treatment, which it's unnecessary. It's unnecessary to be connected to a biofeedback machine or electrostimulation on the first months postpartum. It's quite useless, and it's just going to make you waste your time and money. So, no, but you will have to exercise. And again, we're there to guide you.
So I just want to go back to what you said there at the very start is we're going to do some checks. For people who might be a little bit naive when it comes to this, can you actually tell us what those checks involve? Because I don't want people to be shocked. Like, it can be quite confronting how you do the checks.
Well, it's internal exams. So basically we do a digital vaginal exam, of course, with a pair of gloves. And then we use a medical lubricant, and then we introduce one finger. We ask you to do, again, a few things like coughing, pushing, contracting, etc. We would see that way, how much things are moving. We will check if there's any prolapse, which means that, one pelvic organ might have descended a bit, which is something very common, talking about what's normal and abnormal postpartum. It's very, very common in the first weeks, and then most of the time it just resolves by itself. But we need to check if that's present, and then we use a second finger eventually to test the strength of the vessel. Normally, it's nothing like going to the gynecologist. A lot of women are afraid that we're going to use a speculum or something like that, and will be annoying, but it's not. And most women find it incredibly gentle in comparison to going to the doctors. And we would always do it with the utmost respect. I would tell you exactly what I'm doing. I would ask you, can I keep going? We always take the time to do this. And in Holland, especially, that women are not used to internal exams in general because they never go to the gynecologist unless something bad is happening. Sometimes it comes as a shock, but physios that do this, we're very gentle. So
thank you for that. Yeah, I just feel like, it can be quite confronting. I say, as you said, some people will never have had this done, and sometimes you avoid the gynecologist for these kind of reasons. So for those of us after having the baby, normally we're told wait 6 weeks to 6 months for reigniting intimacy with our partner, to take our time, not to push it and to make sure that we're ready for it. Can you give us your professional opinion on this?
Yes, I really believe that women should listen to their bodies. If something hurts when it comes to sex, just don't do it. We tend to believe that is a problem, but it's actually not most of the time. And you might go from doctor to doctor trying to find a solution to your pain during sex after delivery, but it is completely normal. It's most of the time just due to hormonal changes that are associated with breastfeeding. So whenever you're breastfeeding, a certain hormone goes up and other hormones go down. And the ones that go down take care of the lubrication of a certain area, vestibule of the vagina, which is very specific. And so you might have irritation there, you might have dryness. Sometimes lubricant doesn't help, and that is still completely normal. So don't worry about it. Sometimes it might be solved next week. Sometimes you have to wait until you finish breastfeeding. So every woman is a bit different, but it doesn't have to be abnormal. So sometimes, to save you the pilgrimage from doctor to doctor and a lot of medicines that are not going to change the way you do things. And if it keeps happening after you stop breastfeeding, then that's a good moment to check it and perhaps see if the pelvic floor has gotten a little bit more tense than it should. But sometimes that's actually a result of pushing through it. So to not create an extra problem in the future, listen to your body. If it doesn't feel okay, just try lubricant. If it doesn't feel okay with lubricant, patience.
Patience is a virtue.
Yes. A difficult one in the postpartum, I completely understand, because that's another thing, talking about recovery and how long can it last. You don't have time to recover, which makes everything extra difficult. You're not caring for yourself because you cannot. The only priority is the baby. You don't sleep. When you don't sleep, you don't recover. So a lot of aches and pains and dysfunction and things continue just because your body is in autopilot, basically. And sometimes, patience is the only thing we can have, let's say.
So just to wrap things up, what do you think you would like more women to know before giving birth when it comes to supporting the pelvic floor?
Well, before you are pregnant, let's say that there's a bit of a debate, but I'm more of the team of don't worry about it. Things are good unless you've had problems. So and by problems, I mean if sex has been an issue during your life, sex or internal exams of any sort, or if even, putting a tampon in has been an issue, you should probably address that during pregnancy or before. Or if you have things like chronic constipation or problems with peeing, women that come and say, I have a really small bladder, I'm peeing all the time. That probably is a sign that your pelvic floor might not be in the best shape. It's a sign of tension, mostly. I'm not saying that it's weak, but the opposite. That is what we encounter 99% of the time, during the first pregnancy. So women that have had these issues before. If you haven't had any of this, you don't have to do any specific training or anything. Now, during pregnancy, if you've never had problems with your pelvic floor and you start suddenly having incontinence during pregnancy, then it's a good idea to train it. But check it first, because it might be that, you need some training, but at the same time, you do have some problems with tension. So then we have to see how we tweak the exercises so we can address both. And then just in general, to take care of your pelvic floor, if you don't have any kind of issue, I would say first, be active, train, be in shape. Pelvic floor is part of your body. If your body is in good shape, your pelvic floor is probably also going to be in good shape. It's part of a system. And then just start being a bit careful the moment that the belly starts growing, because the moment that you have that extra pressure down there, your muscles are going to adapt. So most of the time, things are going to be okay. It's not that the pressure increases from one day to another. But when the belly becomes big enough, doing things like holding your breath in order to lift something, or it can just be lifting yourself. Sometimes it just becomes difficult just to stand up when you're very pregnant. If you hold your breath at those moments, then just take into account that what you're doing is basically pressing extra against an area that right now is already under a lot of pressure, and it's already weakened by hormones as well. This is important to know. Your hormones are going to make everything weaker than it is. It's just they affect your connective tissue. So try to protect your pelvic floor by not holding your breath in those moments, but exhaling instead. Not forcefully. It's not about blowing all the way. Otherwise, you're going to press. But actually just a soft activation. Then at the same time, see if you can activate slightly your pelvic floor, imagining that you're kind of closing a zipper. As long as you do that, it's a simple movement. That should be enough for a first pregnancy for somebody without any kind of symptom. If we go beyond that, then it's good to have a consultation.
And finally, if someone is listening to this and quietly thinking, this might be me, what would you want them to know?
Well, first of all, that there is a solution. Don't worry. There really is a solution. There are professionals you can look for. In Holland, you have really good professionals that, are 100% dedicated to this kind of issue. If physio eventually does not work, we also have medical solutions. But we are kind of the first door you should knock at. And most of the time, we can help you find a solution. So don't despair. I find quite often, a lot of women are quite desperate when they come to the practice. But there absolutely is a solution.
And tell me one last thing. What's your waiting list like?
Right now, it's about 2 months.
Okay.
So yeah, it's not, I think it's crazy, but there are clinics with a lot of physios that have even longer than that. They even have to stop. I'm not much part of the more medical pelvic physiotherapy, meaning that I normally don't work much with doctors, in the hospital environment. So I have some patients from there, but I over the years, for circumstances, I ended really specializing a lot in pregnancy and postpartum care. So that's like 70% of my caseload. So in the end, yeah, I find it long, but it can be worse.
Well, Sofía, thank you so much for joining us here on Damn Parenting. Greatly appreciate your, profession, and greatly appreciate the fact now we understand why there's such a big waiting list, because it's about the education you guys go under and there's not many of you out there. So thank you so much for joining us here on Damn Parenting.
You're very welcome.